we're, leery of where we're going to be able to get this project done. And so now when you go to that particular spot, there's an actual building that is actually present.
Yeah.
And then as you come inside, it's like, oh my goodness, this is amazing, because now there's equipment and things that are being done, and we're literally on the last portions of the punch list.
Yeah.
We're actually doing some testing of some of the crop right now. Last week, we can't sell it or do anything right now. But,
right, yeah.
But last week, I had an opportunity to get some of that crop.
I was going to say, have you made some salads or something out of this,
yeah.
right?
So it's amazing, and it's we look at this and it's like, wow, we've come a long way. So you're absolutely right, Joel. This 2024 has taken us. Obviously there's supposed to be, we're actually supposed to be growing some other things, but equipment was pushed back and some other things, but right now we're really down to the last punch item list, and it's an exciting time. So hopefully by the beginning of May, middle of April, beginning of May, we should be able to start selling and
wow,
possibly making some money here.
That's cool. James, talk about like the essence of Grow Erie. Tell me the whole story. Remind our listeners about that.
So Grow Erie is a 17,000 square foot facility. It's an aquaponics facility, not a hydroponics facility, as everybody gets those two things mixed up. Hydroponics is part of the aquaponics process, So we partnered with Intag and utilize their proprietary equipment to assist us in the growing, And I know we had said earlier about the fish portion of it.
Right.
We sort of put the fish on the back burner for now. We still have the space within our facility to go to that level, but because of costs escalating from the initial phase of development to, with the whole COVID thing and the cost of materials going up, we focus more on the grow project, and so the leafy greens and the microgreens.
Yeah, I was going to say microgreens is part of this too, right?
Microgreens and, utilizing the floating beds and utilizing the inside grow facility. I think when we have our open house, that's scheduled, like Shantel said, middle of this month into next month, people are going to be amazed at what has happened on Joyce Savacchio Opportunity Park.
I love that you changed the name too, by the way.
Yeah,
from the industrial park to the opportunity park, because it really is a place where opportunities are happening here.
Yeah, and when we purchased that back in 2016, we wanted to change the view, change the vision, change the whole mindset of the people in that community, let them know that this is a project that they can be a part of. This is a project that's for the community. This is a project that's going to allow for further investment in this area. And so we're hopeful that, with everything that's happened and will happen along this way, you'll see some exciting things coming out of that area.
That's so cool. We just got an announcement from the governor about an investment on sidewalks, and so like this location for Grow Erie is very accessible, and adding the sidewalks is going to be a nice plus, because there's this whole community element of this with the what is it, community gardens? Can you explain that?
Yeah, and I'm glad you mentioned that. But first and foremost, we appreciate the governor and the governor's support. We want to make sure individuals in that area has access to the facility, and obviously, and people can walk to the facility. And so, when we looked at it, because that area hadn't had any individual support of sidewalk upkeep and things of that nature, we say, hey, we want to make sure people have access and safety access to the facility. And so we put a grant in, and we kind of forgot about it, put it in, and then you just forget
That
about
does
it.
happen.
It's like, okay.
Sure.
And then, we found out that it was over
149,000.
Yeah, 149,000.
Yeah, that's fantastic.
And so we were like, wow, this is fantastic. But it also...
Didn't our moms used to say, don't count your chickens before they're hatched?
Correct, absolutely.
Right?
Absolutely right. And so, we put it in and just said, hey, we'll see what happens, and kind of forgot about it. And we got it, and this is going to be a great opportunity to have individuals to have safe access to the facility, because right across the street from the actual plant, we're going to be doing a community garden. How many square feet?
I think the community greenhouse is going to be about 3,000 square feet.
See, that's
Right.
unprecedented. It's actually a greenhouse.
Correct.
This is not just seasonal.
Right.
Yeah,
It'll be...
What's great about that is our partners, Integrated Agriculture Systems, is going to build another greenhouse next to ours that will be utilized to help the community, help schools, and so forth. So we'll have 6,000 square feet of greenhouse on the other side of the road from our facility.
Yeah, that partner of yours has really kind of captured your vision, hasn't?
Absolutely.
We met the CEO. He came to the ribbon cutting, and this thing is working on a lot of different cylinders.
So interesting that you say that. They're also moving a portion of their company into our building.
Like
so
their research
and
yeah.
Yeah, their research and development department is actually going to be inside of our building, so they'll be leasing space for that as well, and doing their research and development portion to try to take not only this project but other projects. Because right now we probably still have 13 to 14 other acres that we can build on and expand upon this particular project. So this is just phase one. And so we're looking to become a situation where we can expand this and hopefully become one of the mainstays in this area regarding these leafy greens and things of that nature. We're working closely with Mcic. Mcic is working with us to purchase the leafy greens and things of that nature. So we have a partner already, but obviously, we would like to grow those partnerships to others as well. But we're really happy with Mcic and what they're doing. The beautiful thing about these community gardens is that we want to create farmers markets and things of that nature, because that area is a food desert, right? And so we understand that, and already in that neighborhood, people are already growing in their backyards. That's what they do. That's how they do it. So we wanted to make sure they had an opportunity to be able to expand that on another level. And so, we'll create an advisory board that those individuals will be able to jump on and give us some assistance in regards to how we split those plots up between the community. So we got a lot going.
Are they like 4x4, or are they going to be like big pots? How do you think that's going to come out?
I think they're going to be like those 4x8s or 4x6s. It depends on how many we can get in there.
Like the steel thing, the steel troughs kind of deal.
That's what we're trying to figure out. These are going to be raised beds.
Okay, sure. Yeah.
And so depending on the size, that will determine the number of people, number of families that will be able to, get a bed or whatever.
It makes you wonder what you could grow in the winter, because you're not really beholden to, what was typically grown here in Pennsylvania, because we have of the climate. You're inside of a greenhouse.
Yes.
Controlled temperature.
Temperature as well. So
we could grow bananas.
Controlled temperature, okay?
Oh yeah.
I've seen the electric bill.
Facility,
okay?
Oh my gosh.
Yes.
Oh yeah.
Wow. Yeah, so you're going to want to start getting that flywheel going on the revenue side.
Definitely.
It's like the investment now has got to start returning.
Absolutely.
What are your thoughts on the rest of those acreage? I mean, are there other ideas other than urban agriculture that could be used at that space, you think, James?
Yeah, so we've been exploring various opportunities, from a co-packaging plant to a facility that raised moths. A lot of different avenues we've gone down. creating a culinary arts space on that for training,
Sure.
But we haven't really locked into what we want to do with the rest of the acreage yet. Hey, we may put another 17,000 square foot facility next to it, depending on how things go.
It makes me wonder if there are people that are looking for warehousing or looking for and maybe the decades when it sat fallow were not the right time, but
Sure.
Erie's a different place now. Don't you think? It's
We're in the rebuilding
growing.
process.
Yes.
More innovative ideas are coming to the forefront, and
Yeah.
more dollars are being invested in Erie. You look outside the window at downtown, how much, $50 million have been invested in downtown Erie. And now that money is going to be spread out all throughout our community because we're going to have the CREZ. And
Yes,
that's going
yes.
to create more opportunities for areas that have been disinvested in.
Is this particular plot of land as part of the CRIZ right now, or?
It does set within that CREZ area, the area that we want
Love to hear that.
focus on developing, that Buffalo Road corridor area.
Yes. And then our organizations are also
Yes.
part of the
Okay.
grid as well. So, yeah.
There's a possible. I mean, again, for people that are uninitiated with the CRIZ, is City Revitalization and Improvement Zones, $15 million is being expected to be inputted into our community for investment every year. Every year on a compounding basis. They're talking about like $750 million over 10, 15, 20 years. Is amazing
Yes,
stuff.
yes,
So
it's amazing.
Yeah.
So and then also to kind of piggyback off what James said and mentioning that, we've had some interest of solar as well.
Oh, there you go. Yeah.
People have approached us in regards to that. So right now, you used a terminology earlier, but we can walk and chew bubble gum at the same time. So,
It's exactly right.
So we definitely
Yeah.
are entertaining other opportunities and ideas. But this project is a feel-good project for us because it will be supporting the community in the food desert. And the beautiful thing is we're creating jobs
100%.
for individuals in our neighborhood and opportunities with the farmers markets to be able to generate revenue and just do what they love to do on a daily basis. Gary has done a great job of cultivating that area with his individual people that he works with, and they do it right in their backyards. If you ever had a chance to go by and get a tour, that's what they do. The
Wow.
Pulse is there, and we're looking to do some training programs and some other different things to assist further as we move along and get the process right to be able to hire individuals right from that community. So it's a process.
But none of this would have been possible without the public and private sectors
Yeah.
being involved in it, And I just always like to acknowledge those people that have been involved in it, from the city of Erie, the county of Erie, the Erie Community Foundation, Erie Insurance, Curtsy Foods, Diverse Erie, Erie County Gaming Revenue Authority. Perry stepped up when we needed him to. Erie County Redevelopment Authority, Integrated Agriculture Systems. They're like our left hand now,
Yeah.
And we're walking down the aisle getting things accomplished, Porter Consulting, without Porter Consulting, our engineer being on site and making sure that all the specs, the design, and everything fit the qualifying factors that INTAG needed to make this happen. The Department of Agriculture, GDIC, our local lead, GDIC, also has invested in our project, along with UPNC Health Plan, First Priority, Highmark Health, and a multitude of banks. From First National Bank, Erie Bank, Northwest Bank, Marquette Savings Bank. Even one of our contractors that is on site building the facility has invested over close to $20,000 into it.
That's fantastic.
So just everything just coming together at the right time to make all this happen for this area. that's been disinvested in for this land that was named after our only woman mayor, to be spurring like this here and grabbing such attention is just phenomenal.
Hold on, gentlemen. I've got to take a quick break here. We are talking to our friends from the Minority Community Investment Coalition and all those people. That is a coalition of people making stuff happen here. We'll be back in just a little bit here on Talk Erie. Talk Erie, the Joel Natale Show. We are live downtown as we're talking about the Minority Community Investment Coalition. And I just want, I just got a couple more minutes. I want to make sure we cover everything with Grow Erie before we kind of pivot from there. And off air, you guys were mentioning just the help that Tina Mangin's outfit at Erie County Redevelopment Authority put towards this. Again, this is all about jobs and economic development, isn't it?
Yeah, most definitely. Tina has just done a phenomenal job. Her staff and her, I think without their commitment and investment to this project, we wouldn't be where we are today. I want to thank Tina, Amy, and Ty, and all the staff up there, Ed Williams, and so forth, because working together cohesively on this project has gotten us to where we are right now. And without all of us being on the same page and Tina giving us some solid advice and guidance, I don't think we'd be where we are today.
Yeah, there has to be a sense of positivity for the future and bullishness on Erie for all of those people to say, not only am I going to help, but I'm putting my money, I'm putting skin in the game to make this thing work. I mean, this is part of that greater movement that's happening here.
You heard James, give you the list of individuals, and the project started off like a $3.3 million project, and then it grew to $5.9 million project. So this is not a fly by night project, and so you need private dollars, you need governmental dollars, you need everybody to jump on board, to change this community. And I think Erie is headed in that direction. And the realization of that, we have to help all, in order for our community to become better and stronger. Because quite frankly, to be honest with you, this area and we're working in, and not only just this area, but certain areas, they've felt hopeless for quite some time that nobody's investing in their neighborhoods.
Right.
And so this is a strong statement that we see you, we hear you, and we want to help you. And that's what the Minority Community Investment Coalition is all about. We take that personally, to be able to say, hey, we want to change the trajectory of this particular neighborhood. And
Talk about jobs. Like
Absolutely.
when this is all fully running, what kind of jobs would be available, and how many do you think would be coming about?
So
here?
we just hired our first 3 employees, believe it or not. And these employees are the technical portion that's needed to make the project flourish immediately. They have that background and those skills and understand the different nutrient levels that need to be in there and how the lighting affects it, the heat and the growth rate and all the stuff we don't know about.
Sure,
These
yeah.
young people that go to school out here and get these biochemical nutrition engineer degrees, those are the people we hired first. And so we have 3 of those people on staff. Next, when we get our facility up and operational, we're looking to hire at least 8 to 10 growers, because this is going to be a 24-hour operation. So we're going to have 3 shifts to make sure that everything is
Wow.
lined up and in order, so that our projected 80% growth rate or more is attainable. One mishap and the whole lot could go.
I mean,
crazy.
will you be like constantly harvesting? Is that how that works?
Yes, quick
Some from like
turnover.
what? Yeah.
There's some of the things that we're growing right now, from seed process to the development and done 8 days.
Oh my gosh.
Quick turnaround. And these are some of the things that Curtsy's, requested us to do. So
Okay.
you're talking about some of those individuals from day one, 8 days later, it's harvested, it's out the door, it's being sold.
So you need those production,
Yes.
those growers. All right, stand by, gentlemen. We're going to take our news break at the bottom of the hour. We're talking to the MCIC. I love this. I love this story here of Grow Erie. And after the break, we'll get into some of the other work that these folks are doing here. It's Talk Erie and the Joel Natale Show. Making things happen here across our community. It is the Joel Natale Show. We're talking with our friends from the Minority Community Investment Coalition. We've got Shantel Hilliard from the Booker T. Washington Center, and also James Sherrod from Martin Luther King Center. Also, again, they're you guys board members of...
We're founders.
Your founders, your,
as well as
your officers.
Yes.
Of the Minority Community
Founders,
Investment.
officers, board members.
Gary Horton's
Gary
involved with
the
this
same.
too. Yeah.
Correct.
And again, let's talk about what's happening in the neighborhoods, because Shantel, I want you to be able to chat about this new initiative that you're doing over at Booker T there.
So Booker T. Washington Center was awarded a grant from the state, which was only 12 grants in the whole state of Pennsylvania.
Oh
wow! In regards to a drop-in center that focuses on individuals who are being affected by opioid use and need assistance with, whatever it may be, some harm reduction type of things. If you need help getting ID, if you need help, getting a Social Security card. We also do transportation services. We also do laundry services. We'll help you get your laundry cleaned. And if you're hungry, we'll feed you.
Okay.
So it's a great situation. It's located at 202 East 26th Street, which is 26 in Holland, right on the corner. And we're partnering with, the drug and alcohol of Erie County and also other entities as well. But this grant comes straight from the state DDAP. And like I said, drop-in centers are becoming more prevalent.
So what does that entail? Is that daytime? Is that 24 hours?
We're open. No, just the daytime services.
But to be able to get services during the day.
Right.
Yeah,
So
gotcha.
we're, and also, it's from 9 to 5.
Yeah.
And then we'll have services NAAA groups as well to be able to support those.
And this is in a separate location
Yes, it's separate
than the
than-
community center.
Correct.
Because you guys are full of
Right.
stuff for the kids.
Yeah,
after
so we
school
have
and all.
a off-site location
Gotcha.
that this facility is going to go to, and we're going to partner with our regular partners. Obviously MCIC will play a part. We'll figure out how we work with them, and we'll work with the community in general. It's a great project. Like I said, it's only 12 across the whole state of Pennsylvania.
Wow.
We were lucky to get it, and it was it started off at 1.75 million over 29 months, and then obviously they made a little bit of cuts, but all in all, it came to about 1.5 million over 29 months.
So that's going to be good enough program, good enough funding to be able to pull this off.
Absolutely, we'll make it work. And,
The
be able to provide
DDAP
services.
secretary was here about a year and a half ago,
Latika.
right?
Mhm,
I
yes.
mean, was she able to see that kind of need?
Absolutely.
Yeah.
She's Latika's great. She's been up here. They actually had something over the summer here.
Oh, did they? Okay.
Yep. And at Prescal, we proposed that, and she said put it in, and she felt the need around here and working with the Erie County Drug and Alcohol. I think we wrote a great grant, and we were awarded. We were, like you said, we wrote it and turned away.
Yeah.
And 4 months later, we
That's awesome.
got the call that we got it, and we're excited about being able to work in that sphere, because in our neighborhoods, there is a lot of opioid use. Fentanyl is running rampant, and so we'll be doing fentanyl testing strips. We'll be doing Narcan, giving all of that stuff away. So there's a multitude of services and programs that are going to come out of this, and we're excited that we can help those individuals.
And the thing that goes along with that is right in the community, able to help community people. They're able to come to a place they feel safe at, that they can talk to someone and be heard,
Yeah.
and not talked down to or anything
Sure.
like that, So having services within the community, is going to be huge for the success of not only the people, but for this program too.
Yeah, it seems like we're getting to a place where we're knowing enough about addiction that we can really have some finesse and some real positive outcomes. Don't you think?
Yeah, it's important. In our community, it's a situation where, if they don't feel comfortable with individuals to come and talk to, we're not coming.
Right.
So you got to have individuals that are relatable, that they feel they can build a relationship and easy to talk to. And so that's what we really feel good about this particular program, is that it gives us an opportunity to build relationships and for those individuals who wouldn't necessarily come and receive resources or services, that they say, hey, that's Booker T. Washington Center, or that's MCIC that's running that program. I feel comfortable with them.
And that's the same.
Yeah, your brands are very strong.
That's the same when we got into the whole COVID thing. We got into COVID because the people weren't going to the health department. They weren't going to the hospitals because they didn't trust the hospitals or the health department. When we got in it, we were able to change that number, and focus on that health initiative.
Yeah, where is that? Where do you think health is at now, James? As far as there's like access. I mean, we talk a lot about health access.
Yeah, there's a lot that still needs to be approached from our community's perspective. We got a little bit off the tip in working with bringing together for the first time the healthcare facilities to work within the systems that were created along with us. I think more of that needs to happen to address diabetes, 100%. To address hypertension, to address all the cancers that are evident within our community, just to put out there the need for a healthy community. Even we can utilize the health department's report that they did 4, 5, 6 years ago and begin right there, But it has to come from within, and the people have to have access from the entities they believe in. And that's why the COVID topsy-turvy was easy to change.
I mean, is there a model in community centers across the country of like primary care living at a community center, for example?
Well, go ahead, James.
That's how it all started.
That's how it all started. Yeah.
Oh, is that Bayfront NATO? Is that what that was?
Yeah, when we had the medical facilities at Booker T and JFK and MLK, and then the changes happened and primary health care came in and ran and operated it for us, and then the whole primary care switched to, okay, we're going to let you guys run all this here. To change their name to Community Health Net, and the hospitals bought out the service. And now today
there's a history there.
We have Community Health Net, we have meds, and we have the place over at ECAC. But when Mr. Ernest Denny and Mr. Harrison and Alex Thompson, the founding director of MLK, got together and realized and understood, in order to build community, they had to have a healthy community.
100%.
That's why they started medical and dental within the community centers that used to be known as NATO 1, 2, and 3.
Okay.
So just to piggyback off of that, I'm going to just be blunt. There's not enough being done.
Is there high demand and they just can't handle it, or is just the access itself difficult?
The access.
Yeah, access.
Okay.
So, we've had this conversation, and so MCIC and our organizations will definitely regroup and come back to that, because there's opportunity to create a more healthy community. Our people do not have access to the necessary resources that should be afforded to them. And the powers that be, whomever they are, should be working with us to create that atmosphere. And, I'm not blaming any or pointing any fingers at anybody, but we know that, and James just mentioned it, and this is no slap at anyone, but, there hasn't been a report done for the minority community for over 4 or 5 years that I know of.
Yeah,
we're not aware of it.
My understanding too is that the health department, I think, is due for another strategic plan. Is that accurate? I'm trying to think. We just had Aaron Marenick on last week.
Yeah, I believe
I think they're up for another.
They're in the process of taking a look at another strategic plan, updating the plan they have, and calling people to the table to have some input. Yeah, definitely.
And we worked very close with Aaron in the health
Sure.
department during the COVID situation, and we would love to work with them even closer in regards to that. I'm just saying, when you're doing these plans or things of that nature, there should be representatives from the
Absolutely.
community helping and sitting beside you to develop these plans. And that's not taking place,
I see.
and that's like I said, I'm not trying to point.
And it's not
fingers
just
at
across the health borders; it's across
Right.
a multitude of borders.
Correct.
Right.
You
Yeah,
know,
a lot of our initiatives, unfortunately, there's the inclusivity is difficult because, let's just face it, there's not a lot of African American CEOs that are out there, whether it's in the nonprofit space or in the for-profit or even in governmental spaces. Honestly, right?
Sure.
Well, there's more than you would believe there is.
But I mean, they need to be welcomed into
Yeah.
these spaces
Yes.
then.
Right.
Because when we're having a community conversation, we're going to have a community conversation about diabetes. Heck, we gotta have African American voices in there because
You would think, right?
because that is one of the number one killers of African Americans in the nation.
Sure.
And we have chronic illness in Erie, Pennsylvania.
Yes, we
it's
do.
not good. We smoke too much, we carry too much weight, and we don't exercise enough. Mm-hmm. I mean, I'm not saying anything.
No, absolutely not.
I'm working on that myself.
I'm rubbing my stomach right now. Like, wait a minute.
100%. And so, but I mean, again, there's, one of the things we learned in COVID is, attitudes about
There you go.
medical,
There
right?
you go. Yeah, you have to change the attitude of the people that you serve, and got to change the attitude of the people that want to serve you. And it has to be inclusive, and it has to be tailored.
Yeah.
To meet the needs of that particular population.
Yes.
One shoe don't fit everyone. Or what does
Yes.
Gary say?
I
I forget the saying what he says.
Yeah,
but,
he says a lot.
Yeah, it's just it has to be tailored.
Yeah. So, okay, I'm going to go there then. So, we're having a serious conversation. I want you to talk about, again, I always say that education is, I believe in what Tim Scott says from South Carolina. Education is like magic. Education took me from 18th Street to be able to have my own talk show over years and years and training and learning and so on. We have is it 70 or even under 70% graduation rate at Erie High?
Yes. It's a 70% graduation rate.
What, in your opinion, again, from your perspective, what do we do about that? Because you know what that does? It keeps jobs out of our community. Because if you're a site selector, what's the
companies
first
don't
thing you look at?
Yeah, companies don't want
How
to
good
do
are these schools?
Yes.
And I'm not saying we have bad schools, but we got to do better. And I know I went there. I'm sorry.
No.
I don't think we can blame it all on the schools.
No, of course not.
I think it has to start at home. You have to have a solid foundation at home that's built on wanting your children to be successful and putting them in situations that they can be successful at, and then working with the school and with your kids to make that happen. We've gone through a lot of studies through our school districts, even the parochial schools, and that's why they're doing some changing right now too, I imagine. But, the old saying, it takes a village. It truly does.
Yeah, I agree with that, my organization as well as James and Gary as well, we've had a relationship with the Erie School District over the last, 3 to 5 years, and we've developed that, and we appreciate their support for us.
Community schools, that's a good model.
Well,
Oh, okay.
Good model. But we talked about being inclusive.
Yeah.
I think should be more inclusive. Put it that way.
It's moving in a more positive direction, and it is having some impact. Mm-hmm. It's definitely having some impact.
And I'll just give a quick background. We started off as one of the partners, our organizations of the Community Schools Initiative.
Okay.
And I think we did it for 2 years, and then they went in a different direction. Okay. And so my point is that you can't do it alone. You need support from organizations like ours. Because guess what? When Sally and Susie leaves the Erie School District, where do you think they're going? They're going to programs like the Booker T. Washington Center, Martin Luther King Center, Urban Erie, John. They're going to these organizations for after-school programming. Mm-hmm. And so you have to work with us in order to try to make things better, which they have. I'll be very upfront. They've supported us the last 3 or 4 years.
More intentionally. 4 years. They've always provided some support.
Right. But this year was a little more difficult. We had to fight. We had to fight for the dollars this year. Yeah.
Are we in a situation where we're still, tearing down old silos? I mean, do we still need to attack the silos and do that work as a village? I'm a faith guy. Mm-hmm. I come from the faith community. I feel like churches are engines that are kind of, could do a lot more, in our communities, in our neighborhoods, and so on.
I would be remiss if I didn't, say this. And I know they have initiatives going in that regards to more teachers that look like the student population.
100%, yeah.
That's an important piece that really needs to be addressed. And I know the Erie School District have implemented some new processes and some new things.
Career pathways
and things of that nature. And I applaud them for doing that. But that is one of the most significant ways that we can change the trajectory of the education of these individual students, looking at people that look like them. That gives inspiration. So we need to do more with that. And I know the district is going in that direction. Hey, and I love the brass at the Erie School District now. I have a great relationship with them. We have a great relationship with them. But look what they just did, in regards to a new superintendent. She's of color.
Yeah, right? we haven't come outside of our district, 50 years, you think, James? Or at least, right? Yeah. I asked the question, I'm like, this is a truly remarkable development at the Erie School District.
Not since I was a student in school. Okay? Seriously.
Right? I believe it.
So, that's a situation where,
again, we don't want to just delineate issues and problems.
No,
we want to be
not.
about on the solution side, and you see solutions happening.
Absolutely, and we stand with the district because we've been, doing programming with them and having that relationship with them. So, we will always be there for the district. No matter what, and those students.
Because we see 60, 70 kids every day in our facilities after 2:30.
And let me say this. Remember when we visited you in our first year? And we did the whole show from Booker T. And I was just so impressed by those young people. Mm-hmm. I'm like, they have a trajectory of where they're going. They knew what they wanted to do. And they were brash and they were excited and they were articulate. I mean, it was just a really cool experience for me to see, this is you make the investment from caring adults into a young person, and it does not come back void. The investment does not come back. I'm using biblical. Yeah, you know what I'm saying? I mean, so
absolutely.
So the bottom line is, by including everybody, if we can build build context of pride, honor, respect, and growing together and listening to each other, and here I'm saying, listen before you speak, that kind of stuff. because our community depends on it. Erie depends on it.
Absolutely.
Our growth in Erie is going to depend on it. It
Well,
does depend on it.
Well,
Absolutely.
even the state of Pennsylvania, I have a son that's graduating this year, from the 12th grade, and this year, as someone that's looking for all scholarship opportunities that you can, to pay for college, so there's a new program that just came out this year. It's called Grow PA.
Nice.
And so what that is basically they're trying to keep individual graduates in the state of Pennsylvania. So you can get up to $5,000 scholarship if you go to a school in the state of Pennsylvania. But then after you leave, so say if you go to the school for you go to get the grant for 1 year, you have to then stay in the state of Pennsylvania and work in the state of Pennsylvania for 1 year.
That's cool.
Without having to pay it back.
Yeah.
So there's people in the state of Pennsylvania, we understand that a lot of our graduates are leaving the state. They're leaving. So we need to find ways to keep them in the state. So that's no different than, investing in our students at an early age to be able to filter into programs like Grow PA.
Yeah.
So the mindset is right.
Yeah.
But I think we need to be more inclusive of those individuals that are working with those youth after those specific hours.
I've got less than 30 seconds. So in a nutshell, what could we look forward to here from MCIC in the next months as we navigate 2025? Oh my gosh.
Well, I know you definitely have to look forward to our open house.
When is that's coming up in a few weeks? Yeah,
it's coming up in a few weeks. Come down and get some of the leafy greens and microgreens that will be growing. From there, I would say keep your ears attuned, keep your eyes open, because there's a lot of great things that's coming down the pike for MCIC in the area that we have our facility in.
Fantastic. We'll leave it there. Shantel, Hilliard, James Sherrod. Thank you guys so much. I feel like we could go another hour.
Absolutely.
But we will pause it at this time. Thank you, gentlemen, so much.
Thank you.
Appreciate it.
Yep.